Good evening. Thank you for joining me tonight. My name is Ryan Soave. I'm a licensed mental health counselor, and I serve as the Chief Clinical Officer for Guardian Recovery. I have spent my career helping people who suffer from mental health challenges, addictions, complex trauma, and often come from very complex family systems. Guardian Recovery is a national system of behavioral health. As a national behavioral health provider, we currently operate in 5 states. Over the last decade, we have helped over 17,000 individuals who have had challenges with addictions and co-occurring mental health disorders. Tonight, I'm going to talk to you about one of our specialty service lines I'm very passionate about, and that's the working with adolescents who suffer from addictions and co-occurring mental health disorders. Our intention, the intention tonight is to provide you as parents and caregivers with information and resources to best support the adolescents in your life that may be struggling and need help. I'm going to talk to you for a bit and then we'll open it up for questions. We've also received some questions ahead of time that I'll be answering in the end. Again, thank you for joining me. The objectives tonight, we're going to explore the services and levels of care available for adolescents, gaining a clear understanding of the treatment that is out there for them. We're going to examine the unique challenges faced by both adolescents and their families, identify key symptoms that may indicate the need for professional treatment, discuss the realities of drug use, self-harm, suicidal thoughts, and disordered eating, understand the vital role of family participation in recovery and the importance of holistic care. And we'll spend a little bit of time learning about our facilities, services, support options, including placement assistance. And again, there'll be an opportunity to ask questions at the end. If you have questions during the talk, please put them in the chat. I'll do my best to either address them as they come up or at the end of the presentation. I want to talk to you a little bit about being a teenager. For those of you who are adults on the call, including myself, we were all teenagers once. I'm not sure about all of you, but I don't know if I necessarily want to do it again or hang out with the teenager that I was, but everybody has a different story. Basically, what I'm talking about tonight is being a teenager is hard. You know, there's a lot of challenges that teenagers face, not only today, but throughout history, I would imagine, but probably more intensely today. And aside from any external challenges, teens are going through a lot of changes. You know, this is a time in the adolescence is a time in life when people are transitioning from being a child that's more dependent to on their way to an adult that wants to be independent. And oftentimes teenagers want to be independent long before they're able or have the capabilities and responsibilities that they need to achieve the goals that they might want to have as adults. And not only that, there are a lot of pressures that they experience from other adolescents, their peers. You know, they've got a lot of pressures that come from academics. You know, they might be just trying to discover who they are and maybe don't fit into the systems of education that we currently have. I don't think I have to stress enough the impact of social media over the last several years. A lot of time is spent on how social media impacts our kids directly, but it also impacts them directly by how the adults in their lives interact with social media and maybe aren't as present with them as they could be. But there are a lot of things that happen on social media that would never happen in person. There's an amount of bullying that happens. It makes it very difficult. I know I'm of an age where I did not experience social media as a child, you know, and if I made a mistake or did something stupid or silly or embarrassing, there was a small audience that saw it, just basically the people that were there at the time. There wasn't even the ability to take a quick video or picture and send it around. And a lot of the teens we work with have faced extreme bullying where something that they've done or said is recorded and posted. It's there forever and sometimes get tens of thousands of views. And so kids are also comparing themselves to not only the people in their community and their schools, but it's easy to compare themselves to people around the world. There's an unlimited population of kids that can compare them. That they can compare themselves to, and often think maybe I'm not doing enough. I'm not enough. I don't look right. I know as an adult, I'm susceptible to that. And most adults that I know are, and it only gets exacerbated and more intensified for teenagers. So it's important to recognize that it's really hard to be a teenager, and not only that, it's hard to be a parent, and it's really hard to be a parent of a teenager. I said in the beginning that I'm a therapist. I've been in this field for a long time. I've worked with incredibly intense situations and worked with people who have intense responses. And I can tell you undoubtedly that the hardest job I've had is being a parent, and not only a parent, but a parent of a teenager. It can be very challenging and scary. And especially when you recognize that something is not going the way that you expected it to, your child expected to, or you recognize that they're in pain or in danger, it can be devastating. So it's not, when we work with adults, there's often a family impact that's happening. With kids, there's an exponential nature to the impact, because we have to, as parents, care for the children. We are committed, at least most parents I know are trying to do the best they can with what they have, and they're committed to the well-being of their children, but often don't know how to deal with certain situations that come up. We weren't given a handbook as parents. And if we were given a handbook that you bought at the store, there's several others saying different things. We often parent the exact way or the opposite way that we were parented. And that doesn't always work with the child that we have, because they're individuals. They're not the same as we were. They don't live in the same time. They have different personalities. But I'm here to tell you that the source of the pain, even if the entire family is experiencing it, it can also be the source and the opportunity for healing. It doesn't feel like that when we're in the middle of it. I know that there's times where my kids have been in pain, and I want it to go away right away. I want them to be okay. I want to do everything that I can to sacrifice myself to support them. And that's not always the best way to go about it. Especially when they're teenagers, they're learning to stand on their own 2 feet. It's important for kids to be able to experience loss, failure, to fall down and learn how to get back up. It's not great for them. That changes over time. When we have little babies, they're completely dependent on us. We don't want to tell our 2-year-old to go get a job or take responsibility for himself in the same way that we would talk to a 16-year-old. When our babies are born, we carry them all of the time. And eventually they learn to crawl. And so they crawl some of the time, and we carry them most of the time. And then they learn to walk, and they're walking some and we're carrying them. But there's a certain age at which they walk and we don't carry them anymore. It's easy to see that as an example when we're talking about them doing something physical like walking. It's hard to understand that when we're talking about the emotional development of a child. And as parents, we can sometimes let go a little too soon and expect them to stand on their feet emotionally, or we can carry them too long. And it's not a matter of being black and white and saying that parents can't make mistakes. We make mistakes. In fact, optimal parenting is not really defined as perfect parenting. Optimal parenting is not that we never make mistakes, that we always do the right thing. I really believe that optimal parenting is that when there's a rupture, when there's a mistake, when there's a failure, that there's a repair, that the children will remember the repair more than the rupture or the mistake. And that doesn't give us license to go out and make mistakes on purpose, but we're going to make them. We're going to have our own emotional reactions tied up in the lives of our children. But the source of that pain, whether it's mine, whether it's my child's, whether it's yours or your child's, can be the opportunity for healing. It's hard to see that, like I said, in the middle of it. But when we are able to identify it and get the help that they need, we can become better as parents, better as family members, and our children can be on the way to being the adults that they want to be and really meeting the life goals and finding purpose in life. So recognizing the signs of when an adolescent might need professional help. We've broken these down into behavioral, emotional, social, and physical signs. Behavioral, notice when there might be behaviors out of line with what you've normally seen. This could be things like grades falling dramatically, or maybe acting out in different ways. It could be using drugs, or finding empty cans of alcohol, or any behavior that might be different before. Maybe a child is really concerned about their weight or their diet in a different way than they've been before. You might see that they're watching social media more than they had, and being impacted by it. Emotional signs, we really want to pay attention to persistent feelings of what we would call negative emotions: sadness, anxiety, hopelessness, or other emotions that really interfere with daily life. Sadness and even anxiety is not a problem in itself. There's an appropriate place for that. And part of life is experiencing things like sadness, anger, fear. But when it becomes something that's so overwhelming, and maybe at an inappropriate time or place, and then interferes with daily life, is something that we really want to pay attention to. Be aware of secretive behavior or withdrawing from family members and friends. It might point to some underlying issues, maybe a change in friend group. That's not always a bad thing. These things aren't always bad, but they're things to pay attention to, especially when they stack on top of each other. Look for physical signs such as unexplained injuries, changes in sleep patterns, shifts in appetite. That these things could all point to deeper problems. We don't want you as parents to walk around super hyper vigilant over everything that your kid does, but to really be aware and look at them holistically and see the patterns of things that might be happening. It's not always that where there's smoke, there's fire, but when there is smoke, sometimes there's fire, and it's important to look. And we'll talk about how we can communicate with our children in a moment. It's important to intervene early and often. And intervening doesn't mean that you have to send them to treatment, or it doesn't have to be an overwhelming response. Sometimes intervening is just having conversations, not just reactively, but proactively. Talking early about alcohol and drugs and the danger and the pressures of social circumstances and the internet, and also talking to them about what might be most important to them, and find out what's going on with them. But there's a real importance to intervening early and often. We work with a lot of adults who were not intervened on as children, and over time, mental health disorders don't just get better on their own. Addiction rarely gets better on its own. In fact, it often gets worse. And if we can intervene early, we have an opportunity to impact a life much earlier on and have a greater impact. Oftentimes, when we're working with children in a substance use facility, they might have just been experimenting with drugs and alcohol. And sometimes they're more challenging than adults to work with, but also sometimes very quickly we can make a bigger difference. They don't have all of the emotional and behavioral and historical baggage that might be driving them. They might not yet have become so cemented in the way that they see themselves, the world, and their place in it. And there's an opportunity. Their brains are more malleable at that age. Some of that malleability is what gets them into trouble at times, but it's also what can support them in healing. Confronting tough issues. Things like substance use, self-harm, suicidality, and disordered eating, they're scary. And most people are not equipped to understand and assess what's really going on. But I think all of us all of us are able to have conversations. We're equipped to be able to be present and not to be in denial or ignore things that are going on, not to be afraid. Well, we can be afraid, but not to be so afraid to talk about things like suicide or self-harm that we avoid talking about it completely. Sometimes people feel like talking about it will make it worse, but I can promise you that not talking about it is what generally makes it worse. That when we can talk about the feelings that people have and normalize them, especially our kids, it's pretty normal for people to have at some point in their life a sense of hopelessness, sometimes thinking like what it would be like for them not to be here. And that doesn't always mean that they're going to commit suicide. And just because we ask about it doesn't mean they're going to follow through with it. In fact, it's often the time at which we can intervene. Self-harm, where kids are cutting or injuring themselves in other ways, is often misinterpreted as an attempted suicide. And they're risky behaviors that sometimes can lead to severe injury and sometimes even death. But oftentimes when we talk to the people who are participating or practicing self-harm, it's what they're getting out of it is not that they want to die. It's often that that's the way that they're able to feel or to stop feeling, or there's some other secondary gain out of it. In fact, they're doing this to be able to regulate their nervous system in a way that they do feel like they can fit in it, and they do feel like they can move forward with life. When talking to our kids about it, it's important to use compassion and non-judgment as much as possible. Now, like I said, I'm a parent. It's not easy to do that. And that doesn't mean that you should beat yourself up if you have feelings that are other than compassion, or you are judging your child or judging yourself. The important thing is to be able to recognize the feelings that you're having and being able to communicate in a way that doesn't come out of those fears or that judgment. To be able to set a time to talk to your kid, maybe not in reaction, but to proactively have a family meeting and talk about what's going on with them. And that leads to having open dialogue. The best that, kids aren't, I know not all kids are like this, but I know a lot of people, including myself, we ask our kids, how's it going? They say, fine. They say, school was great. This is going on, or it's terrible, or whatever it is. And they're not super willing to share everything. Now, some kids will engage in that, but many don't. And the more that we can just be present with them and show that we can interact with them in a way that's compassionate, non-judgment, that we're able to have an open dialogue without always inserting our opinions or always using every moment as a teachable moment. Because the power struggle is real. And if any of you on here that are a parent, I don't think I have to go into too much detail about what the power struggle is. That's where there's a lot of conflict in relationship. And as kids reach adolescence, there tends to be more conflict. Conflict isn't always negative. In fact, having conflicting opinions or conflicting ideas is important. It's important in my relationship with my wife to have conflicting ideas about how we parent our children so that we can invent better ways to be children. We're often asking people who come to treatment to be in conflict with their past, with their beliefs about themselves, the world, and their place in it, such that they're able to take on a new life and look at life in a different way and take different actions. With teens, I really believe that, this is a time that they're really trying to find their own identity and build their own ego strength. And being in conflict with the ideas or having conflicting ideas of what their parents have is a way for them to help identify themselves in the world and kind of separate from being that child that was completely dependent on them to a teen that's interdependent, to an adult that's independent. That doesn't always feel good as a parent, and I'm sure it doesn't always feel good for the child. You don't have to go much further than a meme to see that, a teenager knows everything, or something like, I wish I knew now what I thought I knew as a teenager. They are struggling to find their identity. And the more that we can not lean into the conflict, not take it personally, allow them to have their conflicting ideas and find times when they're not in reaction to then discuss about it and be open to how they see the world without shutting them down, the better that we're going to do. Because in a power struggle, nobody ever wins. And as a parent, most parents that engage in this, they're trying to do what's best for their child and have them find the right way that, maybe what they did as a kid or to avoid their mistakes. And we can't trauma-proof our kids. They're going to make mistakes. And when we engage in that struggle, they become less and less likely to listen to us. And some of their thoughts and ideas are going to sound crazy. And if we can be an audience for them to be able to express that and not react, when we do that, more likely that they'll be able to communicate with them. And the last part of this slide is There's a saying for us as therapists that says, counselor, know thyself, to really know what our own reactions are when we go into an interaction with a client or other team members. And I would say, parent, know thyself. For me as a parent, this is not easy. It's like I said, it's the hardest job I've ever had by far. But to know what's going on with me and what reactions I'm having and what emotions I'm struggling with or might not be in control of. Because when I'm not aware of those kind of operate under the surface and then get interjected into the relationship with my kids. And that's easy to do, especially if we're afraid. When we see our kids struggling or hurt or in trouble, or we're afraid in some cases that they might die, that can impact us in a way that we're going to go into our own, state of survival mode and be in our own reactions of fight or flight. And when we're in that reaction and our child is, that not only creates the power struggle, but it creates more impact and negative impact in the family dynamic and makes it harder to find those points to heal and to find the right places to intervene. Why holistic care and family involvement matter in adolescent recovery and adolescent treatment. First, what is holistic care? It's something maybe a lot of you have heard of. I mean, holistic really means looking at the whole person. So it's not just their psychology. It's not just what's going on with them psychiatrically. It's not just what's going on with them biologically and socially. It's not just what's going on with them spiritually. It's all of these things. It's not just the problem. It's not just their set of character defects or challenges that they have. It's also their virtues and their strengths, to understand the person as a whole being. Because we're not totally just simple creatures. We're very complex. We come to every situation with our own set of ideas, beliefs, and our own history that's informed how we're viewing the present moment. And that's the same with kids, and they're in a time in their life, like we talked about, where they're trying to find their own identity, and a lot of stuff's going on biologically, chemically, socially. And so to really be able to look at the whole person and then put that person in the context of their family environment. We have a saying in treatment that when we see the symptoms that someone is exhibiting, whether it's an adult or a child, that even if it's something that's really not helping them or seems really abrasive or offensive or dangerous, that they come by it honestly. And that doesn't mean they're not in control of it. And that doesn't mean that their family system created it, but it means that the combination and confluence of their history, their ideas, their beliefs, their principles, their experiences have kind of set them such that we can make sense that even the craziest reaction they have, while it might not be helpful, we can make sense of it. We can understand it. And there's a distinction between understanding it and making it okay. But when we can first understand it, then we can help the person move from where they are to where they want to be. And this is true for our adolescents and the families. We want to understand the family history, what's going on with their parents, what their own history was as a child that can help us understand how they were shaped such that they parent in the way they do. And that's not to find blame. Like I said, most parents are doing the best they can with what they have. And that some are doing a very great job and making mistakes and doing a great job. Just like I'll always say that having trauma and having a great life are not mutually exclusive. In fact, they're mutually inclusive. It's part of life. And so we want to understand, how the child was shaped through their experiences and their relationships with their primary caregivers and other family members and the society that they're in, and also get an idea of how their parents and caregivers were shaped so that we can understand how they ended up where they are with the ideas that they have. Not all of them being bad, but we can really start to understand the person. And that's why we say they come by this honestly. It sets the stage for us to be able to understand where people are. You may have heard if you've talked to a therapist or been to a treatment center, they'll often say, we meet people where they are, or we try to meet them where they are. And I don't know if that's always defined, but meeting them where they are is meeting them with who they are, with what their beliefs are, even if we totally disagree with them, even if the family system disagrees with them. But we have to understand what's driving them so that we can design a treatment plan or a care plan that supports them in moving through that to lead the lives that they want to live. And I touched on this, but that's the importance of family involvement. We want to identify the systemic challenges in a family system so that we can also identify the systemic solutions. We do this in adult treatment, but with adolescents specifically, they're going back in the home, most likely. Most often they are. And it's not just about them going back in the home. The parents, who often find relief when their child goes to treatment and sometimes have complex feelings about that, but they've been dealing with something challenging and they know that their child is safe. And now the child's coming back and there may be a lot of fear, anxiety, and we want to understand what drives that for the whole system so that we can put these systemic solutions in place and allow the family to heal together. Because it is recovery for the whole family, not just the identified patient or the person in treatment. This is where the opportunity, where I said earlier that the source of the pain is an opportunity for healing. We might identify the person who's causing the most pain and suffering or in the most danger as the person that needs help, and we need to do everything we can to get them help. But once we get them to treatment and get them the help they need, the absolute best thing we can do is work on ourselves and the family system so that we can find healing and recovery for everyone. So what is adolescent treatment? Or we could talk about just what treatment is in general. There are different levels of care of treatment, starting with the kind of least intense to the most, outpatient care, seeing a therapist, getting an assessment done, working with a therapist and building rapport. Oftentimes when that gets to if that gets to a place where the child is not getting better in that treatment, working with that professional, decide what's best for them. If there are someone who's struggling with alcohol and drugs and they need detox, there are detox facilities and then residential facilities and inpatient where they live for a period of time and then can step down through a continuum where they get more freedoms. Detox being a medical treatment where we're supporting them in a comfortable way to detox from drugs or alcohol. And then stepping into residential care where they're observed 24/7, 24 hours a day, 7 days a week. And they go through a treatment program on a daily basis that addresses the underlying needs that they have, to help them with transferable skills so that they can maintain sobriety when they leave, understand their emotional challenges, and build tools to be able to experience distress, experience pain and sadness and failure and anger without having to go out and hurt themselves more. And then also be available to all of the joy and discovery in life. There's a lot of hope for teenagers, when they can understand that they're not just their problem, or they're not defined by what they're experiencing with addiction or mental health challenges, that they're an individual. They're not that diagnosis, that they're the individual experiencing it, and they're the individual that can find healing and work through it and define who they are as they move into adulthood. There are also other levels of care that give them more freedom, where they step down into something called partial hospitalization, which is our phase 2 programming. And they have more freedoms where they're going out into the world and, understanding how they can start to apply the tools that they've learned. And the next level of care being intensive outpatient, where instead of being in treatment 5 to 7 days a week, they attend programming 3 to 4 days a week for 3 or 4 hours, and they're back in their homes. They're attending school, they're going out with friends and practicing the skills that they've learned on a daily basis, and then having an opportunity to come back into the treatment, a few days a week to work through any challenges they've had and celebrate the successes that they've had. When does treatment become necessary? This is where it becomes important to find help. It's very difficult at times, if you're not a professional, to navigate what the treatment needs are of an individual, whether they're an adult or an adolescent. Especially when you're dealing with it as a parent in the home, it might seem like it's the worst thing you've ever experienced, and it may be. But we get calls all the time where we use a team of professionals to assess and evaluate, what is going on with the adolescent, what is going on with the family. And sometimes we get kids who are coming in and the family thinks, they need detox and residential care. And we find out that's not what they need. And maybe they first need to step into an outpatient care, and we can help the family understand that and work with them. And sometimes we have people calling in who they don't think it's a big problem. They just kind of felt like they needed to talk with somebody. And by the questions we ask, we find out that there's some things that are very severe going on, and we can support them in understanding why their child needs maybe a higher level of care. When it becomes necessary is when, life is being impacted in a way that they cannot participate on a daily basis in the way that maybe they could, or are using drugs and alcohol, and it's a very in putting themselves in dangerous situations. Unfortunately, these days it doesn't take much for with the drugs that are out there like fentanyl, and even the increased potency of THC, very limited drug use can cause long-term damage and sometimes even death, which is very scary. But that's why it's, again, important to intervene early and often. We'll get into talking about some of the treatment options when we talk about what we have to offer and then how we can help you. First, how can we help? As I said, we're a team of treatment professionals who are committed to creating access to great care, but we're also committed to having people find the right care that they need, whether they come to one of our treatment centers or not. We'll have some information where you can reach out to us at the end of this call. We're happy at any point to help assess what's going on with your child, what's going on with your family, and point you in the right direction. Again, regardless of whether it's something we have to offer or not. I'm really proud as our chief clinical officer of the people that we're able to say yes to. I'm also really proud of the people we're able to say no to, because we are not afraid to say this is not what we can help with. It's not in our wheelhouse. It's not what's best for this child at this time, and we'll find the help that you need and point you in that direction. That said, we do have some treatment options that I want to just quickly touch. We have a detox and residential, or phase 1 facility in northern New Jersey, in Montville, that is for boys and girls. They can come there to detox and stay for a residential stay for 2 weeks up to 2 months, or 45 days actually, where we can do significant assessment and really triage what is the next step for them, while giving them some skills and working with the family to really start identifying what the plan is, not only to give them support while they're with treatment with us, but what the plan is going forward to really build the best lives and families that you want to build. In Florida, we have a phase 2 program, which is a partial hospitalization program for teen girls age 13 to 17. They come and live in a home that we have and are transported to the facility 6 days a week. We also provide a lot of outings, and they really do a lot of things to not only work on what's challenging for them, but to find out what's important to them, and also to have some fun and be creative, because that's really important. It's not about just getting sober and well just to get by in life. It's really about how to thrive. We also offer virtual programming in several states in the intensive outpatient setting, where the child can come to treatment while they're in their home. This can also help the family system, so they don't have to drive the child to treatment every day, or they may not have quality treatment in their area. And we have some other intensive outpatient programming throughout in New Jersey and Pine Brook that serves as a place for students or kids to go that are having challenges with school. They come to us during the school day and go home at night. So we have several options with which we can help you with. And again, we're happy to point you in the right direction if what we have is not a fit for you. That is our commitment. Our commitment is for the people we come in contact with, whether they're coming to treatment with us or not, whether we ever talk to them again or not, that we can create value for them and hopefully be a source of inspiration and hope and direction with some solid strategies to be able to get the help that they and their families need. So I would like to open it up now for some questions. If there's any in the chat, if not, I have some that were sent in ahead of time, and I'm happy to answer those. Or if there's anyone that needs to ask a question now. I'll just get into the questions that were sent in if I can find them here. I just had them out. Oh, here we go. How will treatment impact my teen's education and school routine? Number one, it's first most important for your child to be safe. If they're really struggling with a severe addiction and need medical help to move through that, that's number one. However, most treatment centers, and definitely in all of ours, we work with the schools to help them once they're out of the woods physically to be able to continue and not have a great interruption in their school settings. In our inpatient and partial hospitalization facilities, we have teaching coordinators that work with the school systems that the kids come from, and they're able to attend school while they're with us and stay on track. If they are not currently in school, we're able to find other virtual school options for them, but it's really important for us to be able to help them stay on track in school. And some kids come to us who are 17, they finish school, or they're not able to go back to school, and we'll support them in whether that's getting a GED or moving towards college courses. But there should, in fact, going to treatment might actually, if a kid's suffering in this way, may help their participation in school. Will I be able to communicate with and visit my teen in treatment? The short answer is yes. We work with the family to make sure that that's appropriate. We set up timeframes for you to be able to talk to your child. Sometimes the families come in and don't want to talk right away because we need to really understand what's going on first. But we set up a schedule so that you're able to talk with your teen and to visit with them and have even an in-person family program where you can work through some things in person. We also have the families and the child participate in family therapy weekly in our inpatient facilities. That's a very important component. I talked about the importance of the family involvement. So we want to make sure that you're communicating. We want to work with you to find a way that you can communicate and set healthy boundaries in a way that's effective and moves you in the direction that you want to go. How can I encourage my child to participate in treatment? And a secondary part of that, are there aspects of treatment they might find enjoyable? I think first, as we talked about, having an open dialogue and just talking to them, asking questions. If some people get afraid to ask a loved one to go to treatment because they might say no, and know that just because they say no doesn't mean it's always going to be a no. If they say no, there's further intervention that can happen. So you may be able to just ask them and talk to them. You may need to get their therapist or primary care provider involved, whoever's been, and there's other professional services out there like interventionists that can help. And we're happy again to help point you in the right direction if you're not sure how to do that. And are there parts of treatment that are enjoyable? We try to make that part of every day. I touched on that a little bit earlier. It's important for them to have fun, to maintain some physical fitness, to build community. A lot of the kids that we meet have been isolated or are in friend groups that aren't supportive of them, and we want to build a community while they're in treatment so that they can learn how to do that when they get out. But we take them on outings and do fun things along with the really deep work that they do. With our facilities are comfortable and we do fun things. We're trying, and the food is good. We try to make them as comfortable as possible to do some uncomfortable work. Because most people, if they had the option, don't want to dive into the scariest parts of themselves. So we really want to meet them and support them in a way that not only are they doing that, but they can find that they can also have fun and be creative along the way. I just got a question that said, how long would my teen be in treatment if they needed detox in residential? Detox is determined by our medical staff. We need to assess them and understand, what protocols need to be put in place to safely help them detox from alcohol and drugs, or drugs. That could be anywhere from 3 to 7 days, sometimes more if it's very severe. But again, that's medically driven. It's not something that we can say up front without meeting the person, but that's generally the timeframes that we know based on the protocols we have. And then the residential portion of treatment, we love it if our kids can stay in the residential program for up to 45 days total, including the detox portion. Most of them will come for around 30 days and then often find the next level of care, whether that's another less restrictive facility like the teen program we have in Florida, or working in an outpatient or intensive outpatient setting. How is the need for medication determined and what factors influence the choice? That's a great question. We deal with an interdisciplinary team that includes a medical and nursing team that include everything from psych evals to history and physicals, and working with the medical team and clinical team together to really understand what interventions, whether they're clinical or medical, meaning medication, may be helpful. But in any in teen treatment with any medication usage or change, we also involve the family. We need to get permission from them, and we want to make sure that you're on board with it. We don't just give medication to give medication. We want to make sure that we're using medication in the way that it should be used to really support the individual. And just because people come on medication doesn't mean that they're going to be on it forever. It's medication plus, medication plus the holistic therapies that we talked about, so that we can support them in moving towards health. What should I know about insurance coverage for treatment? Well, I'm the therapist of the therapist, so I'm not involved in the treatment of the insurance on a daily basis, but I can tell you that, we work with many insurances, most of the major insurance companies. That should be a part of, once you identify a treatment center, that should be something that they're able to walk you through. If you were dealing with us, we would look at your insurance and help you understand what those benefits are. And if you have questions, to point you in the right direction, to talk with your insurance company or, your provider. And, we can tell you if that's something that we can work with, and if not, have resources for you. But generally there is insurance coverage for treatment in some way. A couple more questions that were sent to me. What safety measures are in place during treatment? That's great. Great question. That depends on whether it's an outpatient setting where they're going home during the day, or inpatient. In our inpatient facilities, we do not have locks on the doors. They're not locked from the outside. We do have locks on the doors where they're not locked from the inside where people can't get out, but we're not locked down facilities. But we maintain, depending on the facility, a staff of security or behavioral health techs that are constantly aware of where the children are and what's going on with them. And this is coupled with ongoing assessments to understand what risk level they might be for running away, or we have to assess for things like suicidality, especially in the inpatient levels of care, and harm risk. We want to keep them safe. And then also really making the program full and robust that they want to stay. So it's kind of a two-pronged approach in the inpatient or residential facilities. When it steps down to outpatient, we're not home with them every day. So, the way that we keep them safe is what security measures are in place as while they're with us. We know where they are, but we're continuing to assess for any sort of risk, whether that's with us or when they're in school or with their friends or at home, and then we're communicating with the families. What support is available after treatment to help my team build a healthy social network? That's a great question too. We support our clients, including the families, in having a pretty robust discharge plan that they can follow. And part of that is understanding what's important to them. So it's not just going to the doctor and following through with therapy, but really being able to understand what's going to help them build a solid social network, and lead good lives, and understanding what the kind of markers are that determine that they are doing these things. And so we help put those things in place. We also have a pretty robust alumni network who reaches out to them. And one thing I didn't touch on in the services that Guardian offers is we have a program called PATH, which offers in-home treatment and long-term case management services that can engage with the child and the family for up to a year post-treatment and really increase outcomes and make it a really robust experience. How can we explain our older child's challenges to younger siblings, especially when discussing alcohol and drugs? This is going to be age appropriate, and if you need support, you could ask a professional, or I'd be happy to, if you reach out to me, I'd be happy to help, but we want to extend that open dialogue to the other kids in the family, especially if a kid's going to treatment, to be honest about it and talk about what challenges are. And this is part of intervening early and often. We don't want to create another elephant in the room that, has the other children wondering, where their brother or sister is, or if they're going to be okay. That there are appropriate ways to talk about mental health, substance use disorders and treatment. And, when clients are in treatment with us, we work closely with the families and are really able to help you identify how and when to talk to the rest of the family. Those are all of the questions I had. If I haven't seen any other ones pop up, so I will close with saying thank you for joining me and us tonight. I'm very happy to have been with you. I hope that you were able to get something out of this. And if you have any questions, please reach out to the number that was on the screen. I think it'll be on here for a few moments after I log off. And if you have any additional questions, you can call in there. And if you'd like to reach out to me and speak, I'd be happy to do so. Again, thank you for being here and have a great night.